Now, we'll talk about a very important aspect of trying to access your patient. So, if you're trying to access the patient, this is basically a patient that you're suspecting that has issues with the nerves. Probably the issue with the nerves is also affecting what? The muscles. You understand? So, there's a way you try to like access for the power of the muscle, in this patient. Okay, indirectly you are accessing for what, how the nerves are functioning in trying to actually what, convey information to the muscles. So muscle grading the power muscles in patients, right? So if you are grading them, you commonly use what is known as what, the Medical Research Council scale, which ranges from, you are trying to grade the muscle strength from 0 to 5. Okay, so the scale is what we always use. Okay, so let's look at the different criteria that we can now be able to say, okay, this person's muscle strength falls within 0, falls within 1, falls within 2, falls within 3, falls within 4, and the rest of it. So when you say the grading power is 0, you simply mean there's no visible or there's no palpable contractions. Okay, so there's like a complete paralysis. If you say that what the grading power is 1, that one there's a flicker or trace of contraction. Okay, so that the grading power is 2, there's active movement, okay, with gravity eliminated. I don't know if you understand. If you take away gravity, the person can be able to move, their part. That will tell you that patients can move limb horizontally but not against gravity. Like they cannot pull it. Where's my hand? Okay, they cannot pull it against gravity, but they can pull it, to the side like this. You understand? To the side. How about 3? The person can move even against gravity. So the patient can lift their limb, but cannot resist additional force. If you leave them to themselves, they can lift it. But if you try to put another force on them, they cannot be able to counter that force. You understand? Then if you see that grading is 4, there's active movement against gravity, and when you put small resistance, they are able to resist it, just a little. Okay, so there's reduced strength compared to what the normal. So number 5 now, this is when you say normal power or full power. Okay, so this one is full strength. Even when you add gravity, the person is still able to resist it. Okay, so why is it important? Okay, these are the different methods, right? We have different methods like manual muscle testings, dynamometry, functional strength testings. So clinical importance, it helps you to identify that what the nerves and the muscles are still in contact, they are still communicating, they are still passing the relevant information. Okay, so it helps you to diagnose all those muscle and nerve related issues. So it helps you to monitor recovery. So sometimes a patient already had the issue, so you are treating them now. So as you are coming around their hospital bed, you're always doing this test to see how your patient is doing a comeback. So it will also guide you on the type of treatment that the patient need. Okay, so that's what we got for this muscle power grading.